had to actually think about how I was going to step up onto a curb or to step off of a curb, because the pain was, just walking, the pain was there. I've been a respiratory therapist for over 40 years, but have been here at DCMH close to 40 years. We cover the whole hospital. We cover the ER, the intensive care unit, the neonatal intensive care unit. I'd have to take frequent breaks, and I didn't want to do that, because I was busy and on my feet all the time.
Number one goal, on all my patients, is to relieve their pain. That's the main reason we offer our services, anywhere from just supportive counseling all the way to reconstructive surgery. Secondary goals are to make them more active and allow them to do more of their activities that they like to do. We took x-rays to see what was wrong, and it showed that she had pretty severe arthritis of her left knee. Her knee cartilage had completely worn out.
I told Dr. Ilya that I wanted to be able to walk the trail again, and the Chester Creek Trail, and he said, okay. So that's what we worked towards.
I said, let's do it, but she's going to have to go through a couple steps before she did that. And in her case, she needed to have surgery.
Dr. Ilya was the right doctor for me, because having worked here for so long, I had the privilege of taking care of his patients post-op. I saw how he was with the patients. His follow-up was good. His bedside manner was wonderful. He knew exactly what he was doing.
I find that the number one calming factor is to talk patients through it, communication. Let people know exactly what they're going to experience prior to having the surgery. So between me and my supportive staff, we try to explain every step in detail as to what people are going to go through.
He said, you'll be out, the next day or the day after, tops. He said, and we get you up the day of surgery. He said, physical therapy will get you up, and they did, and they were wonderful. They were very motivating and caring and understanding.
See, that's the key. That's how you know that things are working fine. Because you're going to forget.
Right.
And you say, did I have surgery?
Right,
exactly. That's the point you want to get to. She finally can start seeing the light at the end of the tunnel, and she can get back to doing her more aggressive activities, such as hiking and walking outside, exercising, getting back to the gym, shopping at will. I felt she was almost there, and she had really progressed as I would have expected her to.
Post-op, when I had seen Dr. Ilya about 2 weeks later after the surgery, he looked at me and said, oh, you can drive now. And I'm like, yay, I was glad.
Because of the team approach at Delaware County Hospital and their knowledge base and experience, I feel confident in the entire experience that my patients had. The
care that I received here was excellent. The girls, the nurses up on 3 East, the techs, food service, everybody was just great.